Part 7. How does magic braces compare with Invisalign? Well, aligner therapy has been around for about the last 12 years, and that's been probably the greatest catalyst for demand for adult cosmetic orthodontics. We all know adults don't want obvious braces, and hence Invisalign's been unbelievably successful. But Invisalign can't do what magic braces can achieve in a quarter of the time. Let's look at our patients, and you've got to remember, as I said, I've been involved in close to 500 Invisalign. I've treated close to 500 Invisalign cases, been involved in probably close to 1,000 Invisalign cases. But this is a patient with some mild crowding of the upper and lower teeth, some rotations, about a 5mm overjet and 4mm overbite. Very attractive girl. And after 31 months of treatment, the result looks pretty good. We've got good alignment of the teeth. It's taken us 2 refinements. It's taken us 11 hours of clinical time with a nice result. But if you look at it very carefully, you'll still see a rotation on that 4-3. And the upper right lateral could be extruded a little bit more. So we're not getting perfection here, but a very, very nice result. A great result by Invisalign standards. Another patient who's even more difficult and really pushing the boundaries of Invisalign, where they've got a class 1 div 2 malocclusion, a very deep overbite, severely retruded upper and lower incisors. And that patient we treated with Invisalign, and they're still in treatment at a aligner number 32 of 37. And we've still got some problems where you can see with the arrows, with the upper left lateral, which hasn't extruded far enough. We've still got some alignment issues on the lower incisor region here. And what we see very commonly with all of our Invisalign patients is this posterior open bite developing. And we see that very commonly because what Invisalign does is has 2 layers of plastic sitting in between the occlusion, and hence what happens is you get some intrusion of those posterior teeth. And this is a very routine finding with Invisalign. So a lot of our Invisalign patients end up with worse occlusions in the posterior segment than when they first started. So this patient's 18 months into treatment, and we've still got more to do. We've still got to fix up the rotation of the upper right lateral. We've still got to fix up the in-out discrepancy on the lower right lateral, and the lower left canine's out a bit too far buccally, and we still haven't been able to extrude the upper left lateral. And if you know, this patient really demonstrates what I've been telling you before. So when they first started, and this was a very difficult Invisalign case, I might add, because they were missing upper laterals and lower premolars. But look at the top slides compared to the bottom. The bottom being after 25 aligners. The posterior open bite is worse on the lower right side, and on the lower left side, significantly worse. And what's happened? There's been further dumping of those teeth due to the intrusive effect of the 2 pieces of plastic. And I asked myself the question, yes, we may have improved the cosmetics of the anterior segment somewhat, but have we given this patient a good service by making her occlusion far worse posteriorly? So after 2 years in treatment, we've still got this significant posterior open bite on the left-hand side and a mild posterior open bite on the right-hand side. And we still haven't been able to extrude the upper left lateral incisor, the upper left canine, which we're making look like a lateral incisor. For those of you who've had experience in Invisalign, we all know that Invisalign is very unpredictable with regards to extrusions of teeth. It is very difficult to reduce deep overbites by intrusion of teeth to a significant amount. It is very difficult to rotate curved teeth, such as canines and premolars. It's very difficult to do a lot of root adjustment position, which means tipping of teeth. So Invisalign has significant limitations as well. So when you compare magic braces with aligner therapy, magic braces is definitely significantly faster. Definitely has more predictable movements. We don't see any problems with extrusion of teeth with magic braces. We don't see posterior open bites occurring. We can upright and align teeth much better. We can rotate teeth, those curved teeth, very efficiently with magic braces. We end up really with a much better final cosmetic result, as well as a much better occlusion. And it's cheaper for the patient compared to aligner therapy. And it's far more profitable for you as the dentist. People ask you, what's different with magic braces technique compared to conventional orthodontics? Well, our technique is we're not altering the occlusion, but we're here to perform cosmetic alignment. How many times have you sent your patient to an orthodontist and they don't want, and the orthodontist spends 2 years wearing elastics, extractions of teeth, and your occlusion still is not perfect at the end of it? Now, nobody's died from a malocclusion. And patients really want to have straight teeth. And my principle in life is make sure I do more good than harm. And if these adult patients, if we perform reversible orthodontic therapy on them, where we're aligning the teeth and straightening their teeth, this is the best approach for them if they don't want to go ahead with ideal orthodontic options. It is not ethically correct for us to leave a patient, I believe, with severely crooked teeth to walk around and be self-conscious because they've gone to an orthodontist who said, you need to have 4 teeth removed, and they don't want to have that. They should still have a right to have nice-looking teeth and feel confident about themselves. The other difference with magic braces is I have a lot of orthodontic tricks where we can move teeth in the most effective way. And all the cases I've shown you tonight on this webinar should prove to you that we can move these teeth in a very quick and efficient manner, provided we make the right diagnosis. And I can assure you that 70% of your adult patients that walk in the door are eligible and will be great candidates for the magic braces approach. Our contact details are Smile Fast Proprietary Limited, Melbourne 95248995. Our fax number is Melbourne 95328532, and our email address is inquiries@smilefast.com.au.